Welcome to Medicare 101. Take out a piece of paper and a pen and take some notes. There's a lot of information to cover. I'm going to do my best to help you save time and money and, of course, avoid any common mistakes or pitfalls. Welcome to Medicare 101. Take out a piece of paper and a pen and take some notes. There's a lot of information to cover, and I'm going to do my best to help you save time and money and, of course, avoid any common mistakes or pitfalls that so many other Medicare beneficiaries fall into. We're going to see what's really important when you're shopping for Medicare health plans. There's so many choices and so many options. Let me tell you, there is no best plan, as everyone asks or even says. That's why we have choices and options, because we all have different budgets and different health needs. Some of the things I want to discuss are the parts of Medicare. We hear A, B, C, D. What are they? How do they work? How and when to enroll? Some of the rules, the penalties, how to avoid them, prescription drugs, what are the difference between Advantage and supplement plans, and what are the steps you need to take. Medicare is health insurance for those 65 and older. It is a federal program, and it's also available to those under 65 with certain disabilities or permanent kidney failure. I'm going to help explain to you what your choices are so that you can really make the best decision for yourself and clear up the misconceptions and help you understand the process a little bit better. Most people are confused about the many rules associated with Medicare, and the biggest question is, when do I need to enroll, and how do I get it? Everyone has 7 months to enroll in Medicare when they turn 65. The month of their birthday, 3 months before, and 3 months after. So if my birthday is in April, I have January, February, March, April, May, June, and July. Enrolling in Medicare is not an automatic process. If you're 65 and you have no other coverage, this is called your initial enrollment period, and you're eligible to enroll in different ways. You can call up the Social Security office and schedule a phone appointment, or the easiest way is to go to ssa.gov and enroll online. If you miss that initial enrollment period, that 7-month window, and you're over 65 and you have no coverage, you're only allowed to sign up January, February, or March after you've missed it, and your enrollment doesn't take place until July of that year. There are penalties for this, so please don't let that happen to you. One of the biggest things people ask me is, what if I'm still working, or maybe I'm not working but my spouse is and I'm covered under them? So if you work for a company that has 20 or more employees, or your spouse does, and the insurance is deemed as good as Medicare, then you do not need to enroll in Part B. You will not be penalized because you have credible coverage, and for this, most people will just enroll in A if it's free. If you're retired and you have company or union coverage, check with them to see if they coordinate with Medicare, meaning if you need to enroll in Medicare to keep that coverage. There are penalties, and we've all heard about them. There are lifetime penalties. So if you don't enroll in Part B, you're penalized 10% for every 12 months you didn't sign up. For Part D, it's 1% per month that you didn't sign up, multiplied by the average drug cost, which is about $33. So I find this a lot where people who are not on prescription drug coverage and don't enroll in D. It's a lifetime penalty. So if someone, for example, does not enroll in Part D coverage for 1 year, 1% times 12 is 12% times the average, let's say 35, it's about $4. So you would be paying $4 more per month for your prescription drug coverage. This is a summary of the different ways to sign up. You have your initial enrollment period, then you have the general enrollment period if you miss your initial from January to March 31st. Special enrollment period is a lot of different things, but this is what you'll use when you stop working. You're given a special election period up to 8 months that you lose work coverage. Most people will enroll within the next month or 63 days for guaranteed issue, meaning no underlying conditions would be covered. Annual election period every year from October 15th to December 7th, you can change plans. And then there's open enrollment period every January to March where you can change or disenroll under certain circumstances. There are 4 parts of Medicare, A, B, C, and D. Part A is hospital. Part B is medical. Your hospitalization covers inpatient for illness, injury, mental health, covers home health care, skilled nursing, which is a rehab. You break a leg, you go to the hospital, then rehab. You have hip or knee surgery, you go to rehab. The hospitalization is covered, everything except out of pocket for you. So you have a deductible of $1,556 for the first 60 days. Then there are per day charges. Skilled nursing facility, you're covered for the first 20 days, and then you're paying $194.50 for 21 to 100. Anything over 100 days, you're on your own because you're considered long-term care insurance. Part B, this is the doctors, your lab work, your physical therapy, your MRIs, anything outpatient, surgical procedures not done in a hospital. You need any type of wheelchair or monitors, ambulance, home health care. You pay a yearly deductible of $233. After that, that's the 80-20 split. Medicare picks up 80, you pick up 20%. Part B, there is a premium for it. Average is $171.10 per month, but it's based on income, so higher earners do pay more. Part C are your Advantage plans. They combine parts A and B and include prescription drug coverage. They can also include additional coverage like hearing, dental, and vision services. You still need to be enrolled in A and B to apply for Advantage coverage, and you need to live in the service area. You'll pay as you go for these types of plans. You'll pay a copay, which is a flat amount. Coinsurance is a percentage of, or a deductible, which is something that you're going to pay before the plan kicks in. Part D are your prescription drugs. They're offered through private insurance companies. They can be a standalone drug plan or part of your Advantage plan. They have a formulary which lists all of the covered drugs, and then they're placed into tiers. And the cost vary based on the tier the medication's in. There are things like formulary exceptions, tier reductions, step therapy, prior authorizations that go along with prescription drug plans. Part D premiums also go up with income. So based on your income, they're going to charge you more for the premium. You have 2 choices after you enroll in Medicare, right? So you enroll in Part A and B. Option 1 is picking up a supplement plan and a prescription drug plan, or picking up a Part C Advantage plan that includes prescription drugs. So the biggest question is Advantage or supplement? What's the best plan? What do I choose? It's really going to be based on your needs. So Medicare supplement plans are called Medigap plans. When you first get into them, after turning 65, you're guaranteed issue, which means that no matter what, there are no pre-existing conditions. They're standardized plans by letters. There's A, B, C, D, F, G, K, L, M, and N, and the benefits vary by the plan. They're standardized, meaning that the coverage is the same per plan, just the premiums are different. And the premiums are different based on companies. So Plan G is Plan G is Plan G. Just 2 different companies have different premiums. I tell people it's like buying a can of Coca-Cola at 2 different places. Typically, the more comprehensive your coverage is, the higher your premium is. Medigap plans, there's no network of doctors. The network is any doctor that accepts Medicare. You don't need approvals or prior authorizations for procedures. You also need to enroll in a separate Part D prescription drug plans. And they're really good for people who have 2 residences during the year. That's why people like them. So here's a chart of the plans. As you can see, G is the most comprehensive. It covers everything except for the Part B deductible. Medicare Advantage plans, they're offered through private insurance companies. It replaces original Medicare Parts A and B. You're not losing A and B, and you still have to pay your Part B premiums. You have different benefits in addition to Medicare. You'll see dental, vision, and hearing. And the benefits have to be equal to original Medicare. So you have to have everything covered that Medicare covers. There are monthly premiums for these plans. Sometimes there are zero premium plans. You're going to have an HMO or a PPO network. So HMO, you can only go in network. PPO, you can go out of network. These plans are very similar to your work plans. And you're going to pay a deductible, a copay, or a coinsurance, but that's going to be in the plan benefits. You'll know what you have to pay. So the biggest question is, what do you need to consider when choosing your options? Well, what's the monthly premium? Can I afford it? Can I see the doctors that I want? Are my prescriptions covered? What are my out-of-pocket costs? Can I use the pharmacy that I want? A broker can help you transition with Medicare. I am a broker. I have a relationship with dozens of carriers, and I'm unbiased because I'm able to give you what you need. I have a working relationship with these carriers. It's different than calling an 800 number. So you can call me first with issues. The thing that I can help you do and a broker can do is help provide steps, guidance, compare different plans to you, help you choose and understand the costs, the penalties, avoid mistakes, and help you enroll and be there for you when you need coverage. As far as compensation, the carriers compensate us all. It's no different than you calling up the insurance company. So why do this all by yourself when you can do it with an independent agent or broker? The rates never change versus going directly to a company. It's the same rate. What's next? Well, you can call 30 different insurance companies trying to find out if your doctors are in network, or you can reach out to me, Doreen Marino, 631-235-8038. Go to my website or send me an email. Click on the link below, fill out the survey, which will ask you a few questions, and then I can better direct you in terms of what you're looking for in your Medicare coverage.